Good day and welcome to another edition of One-on-One with Swope Health. I'm your host, Eric Wesson. Thanks so much for joining us today, and thanks so much for your positive comments and feedback about our podcast. And know this, the best is yet to come. My guest today is no stranger to Kansas City. She is the president and CEO of Urban League of Greater Kansas City, Miss Gwendolyn Grant. Gwen, thanks so much for joining us today.
Good morning, and thank you so much for having me.
So, give us some background. Gwen, you born and raised here in Kansas City?
Yes, born and raised here. Grew up over on East 20th Street. Went to a elementary school that no longer exists. Graduated from Westport High School, and Kansas City's been my home. I lived away from here for 1 year. I lived in Jackson, Mississippi, where I was the executive director of a YMCA there, which was very interesting experience, to say the least. And certainly I knew I had no business being in Jackson, Mississippi, and I came back to Kansas City.
It only took you 1 year to figure that out.
It only took 1 year to figure that out. Came back to Kansas City and started my career with the Urban League.
Okay, that's great. So you went to a school that's no longer elementary school?
It was elementary school, Yeager Elementary School. Yeah, no longer there. There's it's at Indiana and 18th Street. There's a lot there where they have all these
trucks.
Trucks. So yes.
Exactly.
Yeah.
I remember that school too. So this is something that has always, everybody knows you a no-nonsense person. But let me ask you one question.
Oh, boy. Where is this going?
Did you play with dolls when you were a little girl?
Absolutely, I did. I did play with dolls when I was a little girl.
Which were your favorite?
Oh, gosh. Now, you're going to ask
You're
me
not
to
a Barbie. You're not a Barbie person. So.
No, I did. I think I had
You had some Barbies,
dolls.
too?
Yeah, I think I had some Barbie dolls. I don't remember. That was so long ago. I'm thinking about dolls. I'm really thinking about the dolls my daughter played with, more so than remembering the dolls I had way back then. You're going to try to reveal my age. If I start naming the dolls, it might be a good giveaway to my age, so I'm not going to do that.
Okay, but it's like, what is Gwen Grant really like behind the scenes? You bake cookies.
Who said I bake cookies? Where did you get that from?
I was just asking.
I like reading. I like traveling. I like hanging out with my friends. I like good cigars and good whiskey.
The good cigar part, yeah. I've heard of
person.
Gwen was somewhere smoking cigars. I'm like, Gwen Grant? They said,
yes,
yeah.
I'm headed to the big smoke in Las Vegas in a few weeks. I am totally into cigars, yeah.
So how did you get into civil rights in that movement?
Well, so it actually goes back, I believe, to my preteen and early years when Dr. King was assassinated. So growing up in my household, my mother was really someone who, while did not complete her high school education, was really highly self-educated. She read a lot, and she made sure that her children were well-read, that we knew what was going on in the world, and that we should be a part of trying to make the world better. So she was always talking about that. So we watched the civil rights movement unfold on TV, where we saw the dogs and the water hoses and Dr. King. And so when Dr. King was assassinated, I was I think around 12 now. I'm dating myself, right? So I was very young when Dr. King was assassinated. And if you recall, prior to his assassination, he had been leading the Poor People's Campaign. So there was the march on the Washington Mall, and the folks had come and they camped out. And this had gone on for nearly a year, and it was really struggling. It wasn't getting the attention. It wasn't having the impact that he had hoped for. And he was called away from that march to go to Memphis to help the garbage workers during that strike, and at that point where he was assassinated. Well, post his assassination, they wanted to do something to close out that Poor People's Campaign on Washington, and so they held this weekend event called Solidarity Day, and they asked people to come from all across the country, and so churches organized and took buses of people to Washington, D.C. for Solidarity Day, and I wanted to go. So I think I was like 12, 13 years old, and I wanted to go. And my mom said, okay, well, you can go, but you need to have somebody go with you. I'm not going to go. And so get one of your brothers or your cousins. So neither of my brothers wanted to go. And I called them wimps and wusses. Neither of them wanted to go. My cousin didn't want to go. So ultimately, my mother coordinated with these folks at this church, and she let me go by myself with the church folks, which was probably the watershed moment or experience for me that I feel kind of prepared me for the work that I do today. So I went on the bus trip and I got to DC, and I had never seen that many black people together at the same place at the same time doing something as important as the work that they were doing. And it struck me that all these people left the comfort of their homes to go and camp out on the Washington Mall, and it rained a lot, it was muddy, the living conditions were really, really bad, but they went there to play a role in something they believed in, and that was to address poverty in this country. So that just kind of stuck with me. So from that time on, all my work, and as growing up, I was always trying to do stuff that was about helping others or serving people. So I've never actually worked in the for-profit sector. I think I maybe had one little job where I worked at like a finance company or something. But all of my work has been in the social service arena. And then I was blessed to come back after more than 10 years of a career with the YMCA to transition to the Urban League, and then went to my first Urban League annual conference. It was in Houston, and here again, having that all black experience where it's just all these beautiful black people, professional black folks, everyday black folk, all coming together and doing great work and having impact on the challenges that we as black people in America face. And so that's when I was, okay, now this is really home for me, working to address the disparities and the inequities that burden our people, that oppress us, that hold us back. And so I just want to be, really vigilant and present in that space to try to make a difference with the time I have here on earth.
Okay. So what's different? Do you see a difference in the civil rights struggle then versus the civil rights struggle now? Because people think it's over, we've arrived, we've gotten here. It just looks different.
No.
So what do you see that's different in you as a 12-year-old out on the mall versus now?
Well, I think then because there was so much that we were fighting for then, such as our voting rights and our civil rights and voting rights, that there was a whole lot of focus. There was a whole lot of combined and united leadership, I think was the difference. I think now there's while we are still in what we call the movement, the civil rights movement, we have not achieved equality. We have not, I say to folks, like, we are not free. Our slavery has just taken on a different form.
Right.
And so until we are free, this movement will continue. And I think the difference is just the approach. Then it was everybody in that combined effort, and people were much more united, and the issues seemed to be much more urgent. And I think what's happened is that because we passed the Civil Rights Act in 1964 and the Voting Rights Act of 1965, the people thought, oh, we now have equality. But there are so many more policies and practices in place that hold us back. And if we look at where we are today, we're just seeing this consistent movement backwards, the rollback of these rights. So our voting rights are at risk. The Supreme Court is probably in the next week or so going to overturn affirmative action in higher education. So if they overturn it in higher education, then what's next? They can overturn it in employment. They can overturn it in minority participation and procurement. So this movement that was a forward movement, if we pay close attention to what's happening now, we're moving backwards. And it's maybe it will serve to galvanize our people and all people who are pro equity and inclusion and equal rights for everyone. People who care about America's democracy need to unite at this time, and we're at back where we were in the 60s, I believe, where we need to come out swinging to stop this movement, this backwards movement that's ahead. We're going to wake up one day and America's going to be,
totally
very,
different
very
than we
different.
went to sleep with
Yes.
it. And you bring up a whole lot of interesting points, but one of the things that I did want to touch on that you just mentioned, I was watching an election poll. When the show comes out, it'll be after the election. But one of the interesting things that I saw was people were more concerned about the economy and inflation than they were anything else. And in that was democracy. And it was like at 15%. It was polling at 15% of the people that vote care about democracy.
Yeah, it's really frightening to see that and I think the reason that the majority, because I think when you look at that poll, if they break that down demographically, if it's disaggregated by race, I think you would find that more white people, more people who have economic, mobility and economic security are more concerned about the economy. Well, but poor people are concerned about it too, because I don't want to get this, folks to be thinking, oh, she's got it all screwed up. She doesn't know. Like, poor people are concerned about inflation and the economy. But I think that when you do these polls and you don't get the deeper layers of like they ask the questions, but if you don't have a subset of questions that you ask, if you say what's most important to you right now, inflation or democracy, well, that depends on how democracy matters. If you're white in America and this conservative shift in democracy, you're still going to be privileged. You're still going to have an advantage that black people in America won't have until you realize that your freedoms are also at risk. Do you really want to be in a dictatorship form of government where the government is totally controlling everything, and we don't have a fair electoral process? Those things are very dangerous, and with those things comes the threat to the American economy. So it just depends on, you have to have the balanced distribution of power to sustain a democracy. And, I just think everyone should be really concerned about that. I'm deeply concerned about it.
Yeah, I am too. And I guess it depends on the demographic of the people that they poll in these surveys, and usually they don't.
I always say I never get that call.
I've never gotten one, and I'm sure that Ray right now not getting those calls either.
Right.
So when you look around Kansas City, so let's fast forward a little bit, and we talk about the issues in Kansas City, especially in the black community. I want to talk about health for a minute. What is your major concern, and what does the Urban League focus on in helping with health disparities in the black community?
Well, in our recent publication, our latest State of Black Kansas City, we pretty much have taken a position that systemic racism is a public health crisis. It's a public health issue. And so if we're going to address the health disparities, we have to address the systemic policies and the systemic racism that has created these health disparities. When we talk about the social determinants of health, income, neighborhood composition, education, all of these various factors, crime, blight, all these things that plague our communities are the determinants of your health outcomes. We look at it as one of the primary problems which impacts all of this is the black-white wealth gap. So when we look at the median household income or the median net worth of blacks compared to whites, there's almost like I'm thinking it's 171,000. I'm trying to go from memory here, so I may be a little bit off. 171,000 for a white household compared to around 17,000 for a black household. That's the median net worth. And so if you don't have money, if you don't have resources, then it's just virtually impossible to have quality education, quality health care, quality opportunities to, in terms of economic development, all of those factors that impact our physical and mental well-being, at the end of the day, are rooted in the black-white wealth gap, the poverty gap. We've done our equality index since 2006, and we measure, when we look at our index, we look at economics, education, health, social justice, and civic engagement. And we compare how much progress blacks have made in comparison to whites in those 5 areas, with one being whole and white people being the control group. How do we measure, or what share of the pie do we hold? So as we've looked at it over these years, and the National Urban League has done the same, there are 2 areas where we've made the least amount of progress. And, surprisingly, it's not health. It's not education. It's economics and social justice. So look is where we are. We have this huge wealth gap. We also have this social justice system that disproportionately incarcerates black men, that disproportionately kills unarmed black men and women, and the high rates of racial profiling. All of these factors, and this is where we've made the least amount of progress over the years, and we look at it in the context of how much progress have we made since the passage of the Civil Rights Act and the Voting Rights Act, because in most people's mind, that's supposedly where we started from, in terms of, okay, now this is where freedom really supposedly began for us, which is not the case. So so that economic indicator, I write about in the book. I mention about how there was a study that was done that says that if we keep doing the same things we're doing, it would take us 228 years to achieve socioeconomic parity. Well, that study has been challenged, and I agree that it should be challenged, because there's no way that if we keep doing exactly what we've been doing that we can catch up. It's just not physically possible. If you start the race 10 miles ahead of me,
right,
and we're running at the same pace, I'm never going to catch you.
Right.
So I've got to be accelerated. We've got to address policies that will truly have major impact on that. There's no amount of education that's going to close that gap. There's no amount of savings that we can do that will close that gap. It will take some radical change in policy, some reparations, which is a dirty word to a lot of people, but that's what is required. If we are ever going to truly achieve the type of wealth attainment to address the health disparities that we have. So we're approaching it from 2 ways, two-pronged approach. One is to try to address the wealth gap in terms of trying to help folks get livable wage jobs instead of minimum wage jobs. We don't even try to refer people or deal with employers that want to pay minimum wage. Our work in workforce development is about a $15 an hour above job placement opportunity, and also trying to get people into, to support folks getting into management and upper management level jobs, and also into the C-suite. So from an economic perspective. From a health perspective, we're doing a lot of work now on COVID vaccine education and uptake. We have we're in a grant partnership with the National Urban League, and our goal is to get some 2,000 plus doses of first and second doses of the vaccine, and another like 700 plus doses of the boosters in our community, targeting our most distressed communities where we had the highest rates of COVID during the pandemic, and it still continues. And it was just really surprising that it was so hard for us to get our people to understand the importance of the vaccine. It's been a challenge. We just kind of pushing ahead, like, hey, the vaccines work. Yeah. You got vaccinated for everything. You couldn't go to school without a vaccine. Right. So why is it now that this vaccine is problematic? It's just...
So you mean, because I've heard the commercials playing where you are doing the shot, the COVID shot. You mean there's people still don't have COVID vaccines?
Oh yeah, it's a lot of people don't. A lot of people don't have COVID vaccines. A lot of people, a lot of Black people, a lot of us who were most severely impacted don't have
with
the vaccine.
The underlying health
and all the other
all of that, and we still won't get a
issues
shot.
That also
but have a cigarette hanging out our mouth.
All the other issues that we have, with asthma and obesity and high blood pressure, all those things that make COVID even more, challenging for a person, or it increases the likelihood that you could die from COVID. We're not getting. We also are trying to push, folks getting the flu vaccine. People don't realize that the number of people who die every year from the flu. And the flu has been a problem in our community for years. And many doctors have said if we could just get more people to get the flu vaccine every year, it would reduce the impact on the on hospitals and emergency rooms, and that would also help keep healthcare costs down. Because for many of us, because we don't have money, we can't afford insurance. We don't have access to insurance, so the emergency room becomes our primary care physician. So we don't have our regular health maintenance visits, our annual checkups, all those things, because we don't have health insurance. And then we wait until we're in a crisis and we show up in an emergency room, and the cost there is like 10 times more than it would be had you gotten a vaccine, gone for regular visits, even to your community-based health centers such as Swope. Our data shows that we are much more likely to seek health care if it's based in our community. And if you go back to the time of the Black Panthers, they did that. They put health clinics in the community, into neighborhoods, and people would go there and get the care that they need. So that's what makes Swope community health so important, because it's accessible, it's in the community, and because it's here, it does help to, we know that folks come here, and I know that Swope is really pushing the vaccines, and we're going to do some partnering with them as well to try to get these shots in arms as we go into this anticipated serious flu and COVID season.
And in addition to that, you're listening to One-on-One with Swope Health, and I am your host, Eric Wesson. My guest today is Ms. Gwendolyn Grant. She is the president and CEO of the Greater Kansas City Urban League. And if you need that shot, or you need COVID vaccine, or whatever you need along those lines, Swope Health has 17 locations throughout the metropolitan area, and all you have to do is call. You make that first step, Swope will take it from there. So back into the health, mental health issues and violence in our community is overwhelming. We're at almost record numbers of homicides for this time of the year. Nobody seems to have an answer, but I think it seems like nobody cares. I think it's become more the norm, and it's like, oh, well, another homicide. Nobody's really in a panic mode. Yeah. So what are your thoughts on the violence and the cause of violence in our community?
It's really disturbing. I think there are a number of causes. Well, for our community, I think it's PTSD, it's trauma, unaddressed, untreated traumas. We have a high need for mental health services, and if you check into any of these mental health service providers, you'll find that they don't have enough psychiatrists available. They don't have enough psychologists available. They don't have enough beds available to meet the needs. There's that. Then we have our folks in our community who rely on their church or their pastor as a counselor, and these are not professional mental health people. I mean, they are great for, some spiritual support and praying for you, but you can't pray away schizophrenia. You can't pray away depression. You can't pray away anxiety. These things that need a different type of treatment. And so, what we find is that's where our people will go, because we think seeking out professional mental health supports is a negative, and people will,
Right.
call you crazy. And I try to even manage my own language, because language matters. When we see something happen, it's like, oh, that's crazy, that's crazy. Well, then people say, they conflate that into the whole mental health issue and don't want to be associated with
Right.
that. So we've got to find ways.
That's a great point.
We've got to find ways to embed our mental health supports in places where people can get them without stigma attached, and with a lot of anonymity where no one knows they're getting it. We used to operate a program at the Urban League where we embedded professional psychologists as a life coach into our workforce development program, and that provided a space where people could have someone who was a licensed clinical psychologist and not, me, a reverend or me, or somebody can like, hey, yeah, I think you need some help. But someone who really knows and who could get these folks to the help that they needed. And we were able to intervene on some really important situations to address domestic abuse, substance abuse, prevent people thinking about suicide, because this was going on during the time of the Great Recession, and a lot of people lost their jobs, who normally had professionals who had lost their jobs, and there was a lot of anger and a lot of anxiety that was being unaddressed, and we had a service there to meet that. So we need more of that. The other problem is that we have too many guns on the street, and our laws and our policies allow it. So it's like, why do people have guns? Because they can, because it's legal, and which is highly problematic. I don't know, guns with these magazines with multiple fire rounds, it's ridiculous. So you put all that together, the poverty, the blight, the mental health needs, the policies that allow guns, concealed carry, open carry, everybody can be packing. So it's just kind of a wild, wild west scenario. And if you don't have a value human life, because your situation is so bad and you're so angry, and your first response to anger is to pull a weapon and shoot someone, that's a mental health crisis in and of itself, for our community. And it's very, very, scary, and we need to get more mental health supports out there. We need more work done in our schools to help teach our young people the positive ways to resolve conflict. Conflict is a normal thing, and you're going to have in relationships, but we've got to learn how to resolve conflict without resorting to violence.
Right. And, one of the other things is, I say this with a purpose. I think maybe we need more violence in rural areas where those lawmakers live, so that they can live and see the results of it. If I'm a lawmaker and I'm down in Joplin, I don't feel the pain that the people in Kansas City or St. Louis feel, because I'm not living that. I'm not, my kids, sometimes I have them in the car and they'll say, do we have to go down through this neighborhood because it's a bad neighborhood, because they see stuff on the news. And it's like living like that when you're 9 years old, and being conscious of that, I think is something that those lawmakers don't realize or understand. And so maybe we need more violence in their neighborhood so that they can feel this pain and say, you know what? If you have to have a license to have a dog, a license to drive a car, why don't you have to have a license for a gun? And maybe that, because you've said it several times, policy. And I think that they don't feel it because they don't live it. It's just like, I'm sidebarring. But I do feel like that, and I agree with you. All of those elements, when you drive down the street and you see trash all over the place, you see abandoned buildings, you see people living under bridges, you have a sense of no hope. And why should I care about them? I don't care about me.
I don't even care about me, right. and you can't. People try to get a leg up and they can't. It's very frustrating. I say to folks all the time who'll say, "Well, people they don't want to work or they don't want to do this." I said, like that's just so not fair because we see people all the time at the Urban League who are working poor. They're working 2 low-paying jobs and still can't provide enough for their family. So don't assume that when you see people out here engaged in whatever behaviors that they're doing this because they want to. I mean, we have to give some grace to that while also holding them accountable for breaking the law and killing people. It's a very complex process, but we have to be reminded that we got here because of systemically racist policies, and it is not by our doing. It is because we are in a country that was born out of racism, its original sin of slavery, and it has just evolved from from enslavement to mass incarceration to if you look at how we're being policed, that's just another form of lynching. So we got to understand our history to understand where we are now if we're ever going to figure out how we get to a better place. And so I encourage folks to really read, understand, learn how systemically challenging these policies are, and that we must dismantle them if we want to see a better outcome. And you can't dismantle something that you don't understand. You got to pick it apart. You got to know how it was put together first.
All right. And I couldn't end on a better note than that. I was going to ask you one more question, but that was so powerful, and I want our listeners to leave with that note, that message. So I appreciate you taking time out of your busy schedule to come and talk to us. My guest today was Miss Gwendolyn Grant. She is the president and CEO of the Urban League of Greater Kansas City. And if somebody wants to be a member, what do they need to do? Just
visit our website at ulkc.org, and there's a contact form there. If you want to get involved as a volunteer with the Urban League, just reach out and we'll follow up. ulkc.org.
Thank you so much. And as always, I have the greatest audience in the world. Till next week, remember, tough times don't last, tough people do. Until next time, peace.